That'll work. Alright, I didn't expect a lot of turnout for this one since it's the first day of the work week on a Monday, and everyone besides me probably going back to work. So we'll talk about it. We'll talk about my subject and then we'll cut her short here. So, talking about the #1 time management tip for every nurse out there. I can't say, well, for those of you who are listening to this later, my name's Sean. I'm a acute care nurse practitioner. I have been a nurse for going on 11 years, and I have been a nurse practitioner now. This is year 3. So, get a lot of questions about time management, meaning that there's never enough time to get it all done. If you know a nurse, are a nurse, heard of nursing, watched nursing on television, you should know that we are busy, horribly busy. Depending on where we work, what environment we work in, we are overworked, overwhelmed, and there just doesn't seem to be enough seconds in every minute, enough minutes in every hour, and enough hours in every day to get everything we need to get done. Green Mars Joy, welcome. Thanks for hopping on in, talking about time management tip for nurses. Say hello. Or not, that's okay. So, talking about time management tips. Thank you for obliging me. If you just missed it, my introduction, my name is Sean. I am a acute care nurse practitioner. Oh, my wonderful friend Eric always ends up coming in, even when, well, welcome from Russia. Is it Green Mars Joy? I don't know exactly what to call you. Green Mars Joy? Pretty sure that's a nickname of some sorts, but don't ask me to speak in Russian, my friend. I can't speak Russian. I can't speak any other language except English. Stormund, welcome. Thanks for joining. For those of you trickling in, my name is Sean. I am a acute care nurse practitioner, work in a level 2 trauma center. Arena. Now that is a very unique name. Very cool. Well, thanks for introducing yourself, and thanks for stopping by. Just out of curiosity, because I have no idea, what time of the day is it in Russia? I am currently in the eastern part of the United States, northeastern part of the United States, in western Pennsylvania, where it is Monday afternoon at 3:30 p.m. What is it your day and time right now? Just so I have some sort of a reference, because I don't know the first thing about Russia. Dum, 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 as we wait. Maybe she jumped out already. All right, we'll just keep talking then. So, thought I'd talk about time management tips. Had a message or two from a couple nurses on Twitter, and had a couple messages from some nurses on Snapchat as well as Facebook, talking about time management, that there's not enough time to get everything done. And I'm talking about time management. We're going to focus solely on time management tips while you're at work. Because time management tips outside of work, there is a plethora of environmental factors that are going to affect your time management skills. But ultimately, it does rely and land in your lap as to how you manage your time. So, thought I'd give my #1 tip for managing your time the most appropriately while you're at work. And this could be for any nurse working in any environment, meaning it could be working in the inpatient setting like I do. It could be in the outpatient setting. It could be in an office. Could be in an emergent care setting. It doesn't matter. Could be an inpatient in any department, ICU, med surg, take your pick. ED, all the same. This tip was given to me by my second preceptor of my nursing career. So dating back to 2006, 2007-ish. It was my second job as a nurse. My first job was in a small community hospital, worked in a small cardiac ICU. Small meaning that I think there was 12 beds, maybe 12 beds. Then changed jobs and ended up working at a large inner city, I won't say inner city, but large city level 1 trauma unit. It was a level 1 trauma ICU unit that had 22 beds, and it was hopping in there, always busy. There was no such thing as an empty bed, and ICU nurses were paired up, usually doubled, sometimes tripled. So our time management skills were tested beyond belief. And when I was on orientation with this nurse, ironically, welcome Victoria, ironically, that particular nurse that I'm speaking of is also a nurse practitioner now. They became a nurse practitioner about a year before me. Holy, well, thank you for the love there. Victoria, were you in one of my other periscopes? I have a feeling you were. If not, talking about time management. This number 1 tip came from my preceptor at the time, who at the time that they were precepting me, they had been a nurse for 5, 7, maybe 10 years. And thank you for all the hearts. And Savon. I have a feeling there are a lot of people coming in from Russia. This is going to be my gut feeling, is that I'm getting a lot of visitors from Russia. So Eric, if you're still hanging out with us, I think you and I are the only ones who are actually from North America. I'm trying to look and see who's actually here. Yeah, I think so. Nothing wrong with that. This particular preceptor gave me the best piece of advice I ever got when it came to time management skills when caring for patients. And while it applies to mostly inpatient direct patient care, it can be applied to outpatient. It can be applied to any environment in the nursing world. And that best number 1 piece of advice that I ever got was to cluster your care. I'll say it once again. The number 1 tip for the efficient time management is to cluster your care. And what that means is to get all your ducks in a row, to gather all your supplies, to form all of your thoughts before you go on to tackle whatever task it is you're going to tackle. An example being, I am a nurse in an ICU and I'm taking care of 2 patients who are horribly sick that require a great amount of detailed attention. Everything from a head-to-toe assessment. You can only imagine how many systems in the body are affected when you're in the intensive care unit. You not only have to worry about your physical assessment, then you have to worry about medications that you're giving, tests that they have to go to, tube feedings, heart, IV drips. The list is endless. I could go from head to toe and we could sit here and talk a long time about all of the things that a nurse has to take care of when caring for inpatient patients, especially in the ICU. This can translate to anything in the ED. This can translate to anything in med-surg as well. One of the things that you can identify with when you're looking on a nursing unit, you're looking at nurses in general, and you're looking at the seasoned versus the new nurse. Seasoned nurse, I'm going to say a seasoned nurse is 2 years. 2 years, has been a nurse for 2 years. Regardless of what level of nursing they're at, they have been doing the job for 2 years. LPN, RN, BSN, MSN, nurse practitioner, the lot. They've been doing it for 2 years. And then the newbie or new nurse has been doing it less than 2 years, or first day on the job. We'll go to extremes. Someone who's been doing it for 2 years and someone the first day on the job. You can tell almost immediately the difference in the way that they manage themselves when on their unit, when in their work environment. The new nurse will run into the room, hurry up and try and do their physical assessment, and then get interrupted halfway through their assessment and have to run back out of the room. They forgot their stethoscope. Run back into the room and continue on with their head to toe assessment, then run back out of the room. They forgot their pen light to check their pupillary reflexes. Run back into the room and then continue on with their assessment and realize they forgot their pen, so they run back out of the room and they go get their pen. They run back into the room and they can continue their physical assessment and then realize, wait a minute, I don't have my dry erase marker to write on my eraser board in the patient's room. Run back out of the room, run back into the room. This process keeps going forward on and on. When they get done with their physical assessment, they realize, I didn't get any of my medications. Gonna run back out of the room and get my medications. Run back into the room. Start to give their medications or prepare their medications and realize, I forgot to get this particular piece of equipment to give this particular medication, meaning I forgot a syringe, I forgot the correct needle, I forgot the sharps container, I forgot my piston so that I can give my OG medications. You know what? I forgot a saline flush. Running in, running out, running in, running out, running in, running out. And then there's a phone call. Oh, I forgot my phone. I gotta go back and get my phone. This goes on forever. And I am only saying this because I was that nurse. 10 years ago, that was me. Run in, run out, run in, run out. The seasoned nurse, the 2-year nurse, Jim, thanks for joining us. The 2-year nurse, Harry, thanks for joining us, will not run into the room, but instead hang out outside the room and will talk to other nurses about their plan. We'll gather up some supplies, go out and get this, go out and get that. We'll start anticipating what they're going to need. Are the nurses far? I don't know what you mean by, like, physically far? Not quite sure what you mean there, Harry. Talking in regards... Wow. I'm sure that's kind of rude, but thanks. Totally threw me off there, Harry. I don't even know where to go with that one. Yes, I am a nurse, but how does my weight have anything to do with my time management skills? So let me finish my thought. The seasoned nurse will gather all their supplies that they need. They will actually anticipate their care. They will anticipate needing new tube feeding. They'll anticipate the supplies they need to give their medications down in OG. They'll anticipate the medications or the equipment they'll need to give medications by IV. They'll also anticipate to make sure they have all their needed equipment to do their physical assessment. They'll have all these things on their person, or at least carry them into the room or near where they need to be before they walk into the room. And when they walk in the room, they stay in the room until everything is done, and then they walk out. That's the difference between a seasoned nurse and a new nurse. A new nurse is blinders on and focuses on a singular task, one at a time, because they're worried about accomplishing that one task and staying as focused as they can be on that one task. Whereas the seasoned nurse is thinking of the whole picture. Now granted, they have the benefit of already have been walking the walk and already have learned some of the things they're going to have to anticipate. For instance, when you have a patient who's what we call walkie-talkie, able to take their own medications, you're going to have to anticipate that if you're going to bring the patient pills, that you should make sure that they have something to take those pills with. Meaning, do they have the cup? Do they have water? Things like that. And while it sounds like a no-brainer, as a new nurse, you're more concerned with the interactions with the pills. Can I crush the pill? What's the pill going to do to my patient? Is it something I need to worry about with vital signs? Is it something I need to worry about when it comes to bowel function? What exactly is the name of this medication and what does it do? That's an alpha blocker. What's a beta blocker? This is an alpha antagonist. Calcium channel blocker? I don't even remember what that is. So they get focused on the singular task. And that's the benefit of having some experience. So this is why I try and suggest and provide this tip to the new nurses out there, is that you need to start clustering your care. And you cluster what care you know you can perform at one time. If that means being able to have all of your equipment to do your physical assessment, then you make sure that you can do that. And you can check that off and move on to your next task. But ultimate take-home message here is that the number one tip for nurses when it comes to time management skills is cluster your care. Because the seconds, minutes that you save not having to run in and out, in and out, in and out, back and forth for supplies, you're going to have those minutes to do other things during your day. And those minutes could be something as simple as just being able to chart what you did. Or you might actually get a bathroom break. So that's all. That's all I got. For those of you who did show up, the very few that did, thanks for hanging out and listening. Eric, I don't know if you're the only one here or if James is the only one here. So, yes, my friend, dedicated as always. You can take this back to the missus and maybe she can benefit from it. So, unless you have any questions, you got me on the horn. What could I answer for you? Oh, ask away. It's not like I don't have time. Surgery's tomorrow. Any burning questions before I sign off and hit the stop button, my friend? More than happy to answer. Thank you. It's going to be fine. I don't like being a patient, but I'm ready to get better. So, appreciate you hanging out, my friend. We're going to go ahead and hit the stop button here.